Hi there, everyone. Welcome to Lunch for the Soul today. Oh my goodness, you're not going to believe this guest. He is one of the strongest men I have ever had the honor of meeting. He has been diagnosed with cancer, not once, not twice, or even 3 times, but 6 times in the last 5 decades. During all that time, he's a huge physician in Houston. He's been taking care of everybody else, but surviving cancer many, many times along the way. Please welcome Dr. Arthur Hamburger. Good morning or good afternoon now to you. Welcome to Lunch for the Soul.
Thank you. Good afternoon, Melissa.
Wow. Congratulations, first of all, on being the toughest cookie I know. I don't think I've ever met anybody who's been through what you have, and you always have a smile on your face.
Well, I've met a lot more tougher people than myself.
You've met a few through the year, haven't you? So first of all, tell us, what type of cancers have you been diagnosed with from the very beginning until most recently?
Well, number one occurred in 1971, and that was a testicular cancer. And I received surgery and post-operative radiation for that. And then I went along for about almost 50 years without any problems. And then bingo, I was diagnosed in 2017 with both prostate cancer and a type of leukemia called chronic lymphocytic leukemia, small cell lymphocytic lymphoma. In late 2018, I was found to have a non-muscle invasive cancer of the bladder. And at that time, they also found the mass in the pancreas, which turned out to be a cancer of the pancreas. And using the retrospectoscope and looking at my CT scans, they found the mass in the right kidney that is a small tumor that is just being watched now along with my chronic lymphocytic leukemia.
And here you are, just able to fight it over and over again. What do you think, if you had to pick the top things to help you get through these, would it be, does attitude play a big part of this? Does faith play a big part in this? You see sick people all the time who don't survive.
I think it's a combination of multiple factors. Number one, I think it's being aware of things and taking note of them, and so that things can be picked up at the first sign of a problem. My first cancer, I actually found myself after reading a medical journal article. But I think attitude does play a role, perhaps not in terms of curing the cancer, but in allowing you to go through the treatment that is necessary to cure it. So that even though the treatments that are recommended may seem difficult and may be very difficult, to realize that if you want to try to beat it, you've got to go through the treatment as best as you can.
You were so young the first time around, only in your late 20s. What was it like at that point in your life? I can't think of a busier job to be a resident. I mean, we think about no sleep, working so hard, trying to learn along the way, trying to prove yourself. And then you've got cancer.
Well, it wasn't easy. I had a 5-month-old daughter at that time. I'd been married for a couple of years. But I think the strain was probably even more on my wife than it was on me, because I was able to get back to work, keep busy, and put it aside as long as I was feeling well. And fortunately, I continued to feel well, and that made it a lot easier. But it did impact on what I eventually chose to do as a career, and I switched from doing a subspecialty in internal medicine to go on to a fellowship in radiation oncology at MD Anderson. Never thinking I'd remain in Texas. I thought I'd be here for 3 years and back to New York City, but we fell in love with Houston, and here we are.
So that cancer diagnosis ended up shaping who you are today, the medical path you ended up taking, all the patients you were able to help through the year, because you never would have gone into that. I just think that's so intriguing. Now, you mentioned MD Anderson. I can't help but notice your Memorial Hermann shirt. So let's talk about that. So you've ended up working there for decades.
Right. I was at Anderson for 10 years, and then moved over to Memorial City, and eventually moved to Memorial Hermann, and Memorial Hermann subsequently took over Memorial City as well. So I wound up back at Memorial City, and I've been basically a Memorial Hermann person since 1990.
And we take a look at what you've been through, and here you are. Tell me about this photo.
This is looks like it's probably treatment number. This may be I'm holding up 10 fingers, so this may actually be my last chemo
Mm.
at Anderson
That had to be
back in September of 2019.
that was a good feeling, I'm sure. And here you are just
Yeah,
proudly holding that chemo pole with a smile
yeah.
on your face.
They tell you that you can walk around during the chemo. So there were times during the chemo that I walked around the corridors as long as I felt up to it, and just try to keep on moving.
And I love every time I see you, you've got your thumbs up a lot. I mean, that tells me that we've got a positive attitude going on. That tells me that you're saying this chemo is working and I am going to be cured of this disease.
Well, that's what I was hoping for. I'm still hoping for it. I'm not out of the woods yet, but I've certainly moved along.
Well, you have a lot to live for. You mentioned your loving family, and we see your wife here, been married well over 5 decades.
Yes, this was actually taken. Whenever we go to New York City to visit family, we always go to Bloomingdale's 40 Carats to get their yogurt. This is a commercial for them. We always have a huge.
Hey, that's a good commercial for them.
Best yogurt in New York
I
City.
bet. And who is this?
This is my younger grandson, Spencer. He came down here last August to visit for a week, and we found he likes to play tennis, and he got into a tournament up at Kingwood and actually won the tournament.
That always had to be pretty exciting, huh?
There he is. My wife on one side, me on the other, and Spencer with his medal around his neck.
Has that helped you along the way, just concentrating on your family, thinking about your family and knowing that they are there by your side and that you need to fight for them because you want to be here for them?
Absolutely. And my wife was my biggest cheerleader and my biggest helper, and really looked after me extremely well while I was going through the chemo.
You mentioned earlier, I thought it was such an important thing to bring up, that it affects the family so much. Isn't it crazy how your body's fighting it, but you're probably more worried about everybody else around you. And I think sometimes it's even harder on them than you, the patient.
It definitely is. I can tell you there was much more of a strain on my wife than it was on me as far as having to go through the treatments. I knew I had some expectations of what things would be like, but she's not a physician. She doesn't have a medical background, although she knows a lot about medicine over the years, just being married to me. But the strain, there was a lot of big strain on her, but she took it very well. She didn't show it as much as I know it was. She was concerned about it.
Well, and unfortunately, not everybody has a support system like what you've had. What do you suggest as the doctor side of it to people who don't necessarily have a really strong support system when they're sick?
There are organizations that can help patients without a support system. I took training as what is called a can care volunteer. I also signed up to be a volunteer. I'm wearing my Memorial Hermann volunteer shirt. But the volunteering at Memorial Hermann's been a little bit hampered by the pandemic, but I have been going in to speak with patients in the radiation therapy department where I worked, and try to give them some support. I still have my license, but I don't have my malpractice insurance, and so I'm not giving them any medical advice. But I do try to help them in terms of giving them encouragement and pointers about how to handle their treatment.
Oh, that's got to be a big help for them, just to be able to have that advice, and from somebody who knows as the patient side of it, right? I mean, you really have both of that. How do you feel genes have played a role in your cancer? Because unfortunately, you lost your beloved mom, your brother to cancer. I know that had to be a big loss for you, especially as you day in, day out have to continue fighting cancer.
Yeah, well, my brother had, in addition, my brother died from what was called gastroesophageal junction cancer. He also had prostate cancer and never needed any treatment for that. And I had an uncle that also had prostate cancer. So there's probably a familial tendency towards prostate cancer. My brother and I both had genetic testing, and there's a certain gene that we have that is linked to some of the GI cancers. It's not as clear cut as the breast cancer gene, but it's something that's that may have some linkage. And the fact that I had radiation therapy could have predisposed me to other cancers at a later time. But when you treat patients with radiation, the benefit far outweighs the risk. The vast majority of patients who get radiation therapy do not develop cancer, but occasionally someone does, and it's possible that one of my cancers may have been related to that.
Mm-hmm. How are you feeling today? How are you doing?
I feel great.
Good.
My biggest problem is I have some lower back arthritic problems that have led me to go to the swimming pool rather than and spend less time in the gym.
Hey, that's okay. At least you're getting something done. And I see here all those bands on your wrist. You got that smile. We got the thumbs up going. Do those represent the different types of cancer you have, the bracelets?
Those are all my internal cancers that I mentioned, minus I don't have a kidney cancer one yet.
Okay.
On my other hand, I actually have I had a pre-melanoma that was removed a few years ago, and I've had some basal cell carcinomas that are removed. But those are my external cancers, and I wear those bands on the other wrist.
Well, and the fact that you said that it was pre-melanoma, that's huge. So you caught it early?
Actually, my wife found it. She said, "You got a little red spot there." So I went to the dermatologist, and he said, "Well, it may not be anything, but let me shave it." And he shaved it, and it turned out to be a melanoma that had some abnormal looking architecture. So in addition, after the shave, they also took made about a 3 or 4 centimeter incision around to remove it, the area around it, but that turned out okay.
Oh, that's huge. And basal cell carcinoma, so many people don't know about it. I had it on my face and my chest and my arm because I always fought my pale skin as a kid, and my mom would put sunscreen on me. I would wash it off when she wasn't looking. And I tell you, I've paid dearly for it. But I think that we've gotten better with sunscreen because it's the most preventable type of cancer there is, don't you think?
Yes, it is. I've actually not been out in the sun since my radiation treatments, and the basal cells that I've had have been in the area where I was tanned. I grew up as a teenager and a young child. I grew up very close to the beach, and I used to go swimming every day, and that it was sunny in New York, and used to get quite tanned. But since the age of since I had the radiation, I've stayed away from the sun, and I haven't had a basal cell in many years. I've had some actinic keratoses on my face that were frozen, that are precursors of squamous cell cancer, which is the more serious one. The basal cells, fortunately, will not. They almost never spread.
Right, exactly.
And you just have to not let them get too large.
Sure.
It's the squamous cells that are the dangerous ones.
Mm-hmm. Well, we always hear if you had to get a cancer, basal cell's the best one to
Yes.
get. But not so much with pancreatic cancer. That is one of the most serious there is. Now, you were treated for that 3 years ago. Are they just closely watching you for that now? Do you have to go back in for scans? What does that look like for you?
I used to go every 4 months for scans. Now I'm up to an interval of 6 months. And the further I get out, the better the chances are that it'll stay away. But I'm not out of the woods yet. But I just keep my fingers crossed for that things will stay well. About 2 weeks before I have my CT scans, I get a little bit nervous. But the rest of the time, it's just put aside.
How much does your faith come into play with that, and trying to keep those thoughts out of your mind of could it come back?
I think that it's allowed me to put in perspective put things into perspective. I'm Jewish, and in Judaism, where I don't know for sure what the world to come holds, but I do know that you try to conduct yourself in as good a fashion as you can while you're here on this earth, and none of us live forever, and you just hope that you have a chance to live long enough to see your children grow up, see grandchildren, and unfortunately, many cancer patients don't get that opportunity. And I feel I've always felt very fortunate that to be able to have reached the point that I have.
Mm-hmm. And I think that a lot of times a cancer diagnosis, and you've had 6, bring a lot of positive things in life. I think you stop and smell the roses more. I think you see the sunlight and the sun shining down on you and you feel it on your skin, right? I mean, do you find you appreciate life perhaps more than some?
Absolutely. The little things don't bother me at all. It'll really take something that is major. I think obviously the biggest thing that you're concerned about is going to be the health of your spouse or your children or your grandchildren, and as long as they can stay healthy, that's
Oh,
what's important to me.
Yes, it is. I mean, you think about those younger people in your life, and I'm sure that they are probably paying attention to their health more than ever, aren't they? Of just really paying attention to their bodies, which we're all supposed to do.
Well, I hope so. It's hard to get young kids to go on a protein shake diet.
Oh, I believe that.
Yeah.
Tell me what this felt like, ringing that bell, and how many times have you gotten to ring it?
This is the only time that I've gotten to ring it, because this was at the very end of my chemotherapy. You don't get to when you've had surgery, you don't get a chance to ring it. At least not to my knowledge. You're just happy to get out of the hospital. At the end of radiation treatments, patients also will ring a bell like that. But this was done at the time of my final when the IV was disconnected from my final course of chemotherapy.
How glorious was the sound of that bell?
It sounded great. I was happy. I was delighted that I was done.
I bet. And you want to be done forever, right? No more cancer.
Absolutely. I still have my port that they gave me the chemotherapy in place under the skin in my upper chest that I get flushed once a month, but hopefully it won't ever be used.
Yeah, we don't want you to use it anymore. Have you changed your lifestyle at all? You look healthy. Do you eat healthy? I know you still try to work out in any way that you can.
My wife always kept an eye on what I ate, so I can't say that I've changed my eating habits that much. The major change is that because of my arthritic problems in my back, and with the onset of the pandemic and not being able to go to the gym, I moved out to the swimming pool. It's a heated pool, and I found that I like the pool more than I like the gym. So if there's a lightning storm and the pools are closed, then I go inside. But otherwise, it's an outdoor heated pool, so it can be 35 degrees, and I've got myself a swim parka. I run and jump into the pool, and it's like being back in the womb.
Oh, brilliant. Well, we know it's easier on the joints, so no complaints there either, right?
Yes.
Well, thank you for all the service and all the patients and all the people you have helped through decade after decade in Houston. You've been through a lot, but you've also helped many others get through a whole lot of their own health concerns. So I just want to thank you for that and all you've done.
Well, thank you. Thank you for having me.
Being here. And again, only good health for you from now on. I hope you'll stay in touch with us and let us know how you're doing.
Thank you. I shall.
All right. Love having you here on Lunch for the Soul. And just a reminder that you can meet us here every Wednesday, 12:30. It's the place to be. We are always trying to find really uplifting stories of people who have come through the unthinkable. Next week, you're going to meet a family who got to meet their loved one's organ donor. It's one of the hardest things that a family has to go through, because it's that bittersweet moment of knowing they lost their loved one, but many other people get to live because of their loved ones. So that will be a really uplifting conversation of how it has helped them work through grief to be able to have that very special meeting. And you'll get to see that meeting happen right here on Lunch for the Soul. If you have any ideas or a dramatic situation, please share it with me. You can always reach out to me here, and I would love to talk to you as well. Take care of you. Thank you for being here. And I hope you all have the most beautiful day ever. See you. Bye.